Okay, I think maybe we'll go ahead and get started in the interest of time as well. Welcome everyone, and thank you for joining us for the Grand Bargain Cash Workstream webinar week. I hope it's been a fruitful week and that you've had a lot of rich discussions and opportunities to learn. Before we move on, I'd actually like to thank all the co-leads for the sub-workstreams and everyone else who's helped put together the week. And then also just to note that we'll be sending around recordings of all the sessions in case you've missed anything or you want to watch something again, as well as a report of the week's outcomes in the next few weeks, so stay tuned. And just a reminder that this session is being recorded, and also to remember to keep yourselves on mute and to turn off your video unless you're presenting. So for the closing session, we have three speakers. So firstly, Adam Bornstein from the Danish Red Cross, who's working on innovative finance and systems change. He'll discuss issues around community inclusion currencies, focusing on a case study in Kenya, and how these link to social protection and humanitarian cash assistance. Then followed by Meg Sattler from Ground Truth Solutions, who will speak to ensuring that we put people first, keeping COVID-19 in mind through case studies in the Central African Republic and Syria. And finally, Catherine Teach, Global Cash and Voucher Programming Director from World Vision International, who will speak to social protection and social accountability on how to bridge humanitarian and development engagement. We will have time for Q&A. If you have any questions, please add them to the chat bar. My colleague Sam Brett from DFID will be moderating the Q&A. And then finally, we will end with concluding remarks from Ken Crosley, WFP's cash coordinator. And with that, I will pass on to Adam. Thank you.
Great, thanks, Dina. Good morning, everybody. I am calling in from the United States, and today I want to talk a little bit about some of the platform that the Danish Red Cross, the Kenyan Red Cross, Norwegian Red Cross, and some of our other partners have been working on. And we're basically calling this a community inclusion currency platform. But I guess before I get into that, I wanted just to give you a quick brief overview as to what the Danish Red Cross Innovative Finance and Systems Change looks at. Essentially what we do is that we think about subjective and objective, qualitative and quantitative data, how we can fold those into interventions from a humanitarian perspective, but also lightly touch on the development scope. And we look at this in terms of thinking about risk models. And so in this realm, we look at natural disasters, catastrophes, we look at drought, we look at migration. And from those risk models, we look to develop different types of financial products. And how do we kind of package these products up in different types of innovative financing wrappers, such as the catastrophe bond or cash transfer or securitization. And then that helps us sort of link to different types of donors and private sector investors, as well as different partners that may be in the focus of like for-profit, for example, such as Accenture and things of that nature. The Community Inclusion Project started in 2019. It started from a crowdsourced idea session that we had in New York City on the back of insurance program around insurance-linked securities, which is basically a capital markets product that allows us to transfer risk to private investors. The idea essentially is to create a response and recovery platform that is based off of a mobile network, and the concept being that when there is a disaster, or if there is an idea to focus on resiliency, we can flip between the two different types of interventions. So since we started the program initially back in, I would say, January 2020, we've had a 500% increase in the number of users in the urban sector. And this is mainly because we were moving from a response platform into from a recovery/resilience platform into a response. And we were focusing our attention in a informal settlement in Kenya, in Nairobi, called Mukuru. Overall, the platform has basically generated 300,000 trades. This is individual trades between different parties. We have about $1 million in trade value, and essentially it has touched about 30,000 households, or about 150,000 individuals. I'm going to play a quick video if I can manage this, and if it works out properly, you'll get an overview of what the community inclusion product looks like. Just give me a moment, please, and I will go ahead and make that happen. Let's see. Share the screen.
Songa is a shopkeeper in Africa. She owns a well and sells the water to her many neighbors every day in order to care for her children. But her neighbors don't have money to buy water. During crisis times, she cannot afford to pay for food, medicine, or school fees. Why do economic downturns and crises have such a devastating effect on local markets? Each one of Songa's neighbors has something important to offer that other members of the community want and need. They are babysitters, farmers, nurses, cooks, teachers, tailors, shopkeepers, carpenters, and so on. During a crisis, each of these neighbors still has goods and services to offer each other, yet they don't have the money to purchase from each other. There is a new solution called community inclusion currencies. Songa joins a network of farmers, teachers, and small businesses that are trying to create a stable marketplace by trading their goods and services amongst themselves. The network pools their resources as well as donor assistance from cash and voucher assistance programs into a community fund. This fund is leveraged to create and back digital community inclusion currency credit. Songa receives community inclusion currency credit as shares of the community fund. Now she can meet her basic needs by trading them with other community members using her simple phone. Community inclusion currencies are securely and transparently created on the blockchain, backed by community goods and services, as well as national currency to increase the amount of locally available credit. Songa can now use her community inclusion currencies to purchase nutritious food for her family from a local farmer. The farmer can now pay a bicycle operator to carry his wheat to the market. The bicycle operator can now pay for his daughter's nursery school fees. And the school teacher can get water from Songa, finishing a full cycle of trade during a crisis or poor market conditions. With CICs flowing through the community, trade increases and the market stabilizes. Songa's basic needs are now taken care of even during a crisis. People like Songa, who have limited resources, can come together to trade with their community inclusion currencies even in times of crisis, and they can save their national currency and pull out their community funds for essential imports and building their local economies. That's how community inclusion currencies complement missing national currency. Humanitarian aid organizations, such as the Red Cross, can use economic data to better understand local economies and support vulnerable communities by adding community funds and creating more credit for communities in need. Community inclusion currencies give people simple but powerful tools for utilizing their resources to pull themselves out of crisis and poverty.
All right, a little off on the timing, but essentially, hopefully you guys got the gist of it. Let me go back to the presentation.
When a region is affected by a humanitarian...
Oops, sorry. Let's see here. Okay. All right. So essentially what we've done is we've thought about our cash transfer program, which is roughly about $1 billion a year across the Red Cross movement, and asked the question, how can we make it more effective and more efficient? How can we take the donor funding that we use to support communities in need and almost make it a resilience tool, as well as see if we can use that capital to stimulate behavior change as well as engagement. And then how do we use that data to inform our program in real time in terms of what we're focused on, where we can put more assistance. The dashboard that's in front of you is essentially a screenshot from earlier this morning of the data that we get from the blockchain that the Community Inclusion Currency Project reads to and writes. And essentially on here, we can see on a daily basis how the cash is being used around food and water, farm labor, savings groups, shops, which is basically soap and water. And this can then be condensed into algorithms. It can be condensed into different types of financing structures. It can be used into predictive analytics to essentially help our community workers on the ground become more effective and efficient. And I can send the link for this. It's basically public data. It's up on the web. It's anonymous. We cluster it, so there's no way to actually go ahead and see who specifically this is related to. So I just want to quickly touch on the program that we have related to COVID. So in April of 2020, we pivoted from this resilience solution into a response in relation to COVID. It was in Mukuru, which is essentially the eastern portion of Nairobi, close to the airport. It has about 200,000 individuals. Maybe more, but that's basically kind of like what we're looking at. Our approach for this program was to, well, actually first here are some photos of the different individuals. We had our trainings with the Red Cross individuals on the bottom here. On the right-hand portion is the type of trainings that we do to teach different community members how to use the system itself, and we use kind of basic role playing games. And then the lady up top here at 11 o'clock is one of the shopkeepers who's using the Sarafu or CIC program. The way we integrated it was to work closely with the community-based disaster response team, which were essentially chamas. And these are savings groups like Silks or VLSAs that are in the community already. In Mukuru, there are about 25 of these individual sort of chamas, and for each chama, there's about 25 of these health workers, and we assume they can kind of outreach to about 100 or so different individuals. And essentially, that was kind of the way that we introduced the program. Quickly go through this. What we were focused on is around behavior change, awareness building, thinking about different types of interventions and campaigns, and we had different approaches to microtasking. We looked at how to operate in an environment where there was social distancing, being able to share knowledge digitally, as well as incentivize people to engage in these programs. The type of results that we had through this platform, essentially in April, and I'm just looking at April as a caption shot because that's when we started the program, we went from about 40 households to 2,600 households in about a month. We had almost 23,000 different transactions, and this is between individuals. We traded almost $100,000 worth of goods, and all we injected into the system was nearly $3,000. And so that multiplier effect was nearly 30 times, which is very high. We seem to usually get around 10 times multiplier effect, which means that we can drip the money in a slow process, but still get a very large output in terms of value. And so from an efficiency and effectiveness, that's pretty high. We did a survey, and the survey was done in the end of May, just to sort of to validate what we were seeing from the data that we were collecting in real time. And we asked the question essentially, which was, were you positively affected by the CICs? Did it help your consumption? Were you able to get goods and services that you typically couldn't get? And from the response, almost 60% of the women and over 60% of the men said that they saw a significant increase in their consumption, of which 62% of the female users, and between the age of 26 and 36, basically said that they were the highest traders. They're the ones that were actually using the CICs the most, which is important because in these informal settlements, women and employment and that focus on family and cohesion is really important to the Red Cross around resilience and well-being, and that's one of our target groups. So that kind of confirmed it. We went a little deeper and asked another question, which was, were you able to buy things that you otherwise could not? And 73% and 71% of men said yes, otherwise we wouldn't be able to buy water or food or soap. And having this additional liquidity in there allowed us to make that happen. And then we asked the question, which was, did CIC intervention make you more aware of COVID-19? And this is important to us because we tried different types of interventions. We tried, I mentioned something around microtasking, which is to sort of almost like gamifying the approach of aid to teach people about, washing your hands and to use soap. And obviously 80% plus said, yes, it did. And what was really interesting to us were that the older population actually is closer to 100% when you include people over 59 years old, said, yeah, that this was a really good way for them to understand what was happening on the ground. Now what we can do is that we can cross-reference our qualitative data and the quantitative data that we're collecting from the surveillance and from the surveys on the ground to the data that we receive in the system. And what we could see is that in March, savings groups, which are basically silks and community chamas, they were accounting for the largest trade volume of the platform. And that was when we were focused on resilience. But as soon as we moved into a response mode, food and water became the top item of purchase and of trade. And again, when you look at it from an individual basis and you adjust for the fact that, yes, we had a steep, almost hockey stick or J curve incline in the number of users, when you do it on an individual basis, we could see almost 100% or over 100% increase per individual on their consumption of water and food and sanitation items. So I'm going to leave it there, open it up for, I guess, hand it off to my colleagues. But that's essentially how we look at using blockchain, digital technology, and our cash transfer program.
Great, thank you. And with that, I'll hand over to Meg.
Thank you, Dina. Let me know if you can't hear me. I'm having a screen sharing problem, so I think Dina is going to kindly share my presentation. All right. For those who don't know me, my name is Meg Sattler and I'm a director at Ground Truth Solutions. Ground Truth Solutions aims at empowering disaster-affected people to influence humanitarian responses by systematically asking them how they feel about the response programs from which they are supposed to benefit, and using those findings to dialogue with various actors who are able to act on the findings. I think as many of you have seen in a number of other cash presentations, our findings are often used to make the case for an increase in cash and voucher assistance as an aid modality, and quite rightfully. Our surveys consistently do show that people would prefer cash, that cash is considered a need not meant in almost every humanitarian response, and also that people are very frequently selling aid items to meet their most basic needs, which renders the whole humanitarian supply chain somewhat ineffective. People are often selling, for example, food to buy different types of food. We've seen that in Bangladesh, or non-food items to buy medicine. So it's not rocket science to assume that people know what they need, and most economies know where and how to access it. But our role at Ground Truth is also to listen to people and to listen to more of the nuance in what they say. So I wanted to actually use this opportunity of this brief presentation to share some of our recent findings from Nigeria, the Central African Republic, and also Syria at a more local level. I suppose to reinforce the fact that while COVID-related access constraints may reasonably be more actors into CVA territory, cash and vouchers in themselves are not going to be the answer to the aid accountability problem. Based upon what a lot of affected people have told us, now is the time for more, not less engagement, but the opposite is what we're seeing, unfortunately, despite the many difficulties that agencies are having in reaching populations. I know it's very easy to say that we need to improve accountability when it's a very difficult time to do so. We at Ground Truth are definitely facing difficulties doing the same. Our methodologies have in some places been very drastically challenged by access issues, and our teams are working in overdrive, trying to ensure that we're still speaking to vulnerable people and that their views are heard. But because I think some of these findings are quite new, they will not be shocking to you at all, but they will hopefully provide some often sobering, but hopefully also useful food for thought. If we go to slide 2, these are some findings from Nigeria, where we've been speaking to aid recipients as part of our Cash Barometer project. Cash and voucher assistance is a preferred modality there. But our most recent survey showed that only 65% of respondents feel that their cash and voucher assistance being distributed actually goes to those who need it most. This is not an overwhelmingly high percentage, especially given that we ask this question of the recipients themselves. People who do not believe that the assistance is targeted to those most in need cite a range of different groups, mainly older people, children without guardians, or persons living with disabilities. A few respondents also said that they missed out because they or the head of their household were absent at the registration, or because they lacked access to the means of distribution, whether that was a card, a mobile phone, or otherwise. So it is quite clear that more engagement is needed with community members to find out which tailored payment systems will be most appropriate to reach those who are the most vulnerable, particularly given the additional constraints of COVID-19. The second finding is also quite sobering. In some ways, it's a positive finding because 90% of people feel that they do not have to pay others or offer favours in order to receive their cash and voucher assistance. But this was quite a large sample size. It's over 1,000 people, and still 10% of those people feel that they do. So that is too high. These findings were also shared by community leaders who told us that mobile money recipients often experience fraud at the hands of money agents, and I think that's something that won't be new to any of you as cash experts. If we go to slide 3, the findings on fairness and rights were concerning. I think the findings on information are quite depressing, as they seem to be in a number of countries. So still in Nigeria, respondents are unsure how long they'll be receiving assistance for and how aid agencies decide who even qualifies to get it in the first place. These findings are consistent with our surveys in other countries. So in Kenya and Iraq, they were very similar. So this is definitely not a phenomenon specific to Nigeria. Of course, with the access constraints in Nigeria and increasing violence, it may be difficult for aid providers themselves to predict how long assistance will continue. And that's something that we definitely understand, but at least we need to communicate the targeting. And only 11% of our respondents say they know how aid agencies decide who receives cash and who doesn't. The majority think that it's based on some sort of needs assessment. But there were a number of different responses given to this question, which sort of provided enough evidence that clear information is definitely lacking. 1/6 of the respondents who did feel aware or thought that they were aware of CVA targeting still believed that the targeting came down to luck or chance. So we should be able to communicate targeting with enough transparency that nobody thinks that. If we go to slide 4, in terms of their experience of cash and voucher assistance, respondents are less positive about whether the assistance enables them to cover their most important needs. Almost half of the recipients surveyed in Borno responded negatively on this one. And mobile money and paper voucher recipients felt less positive about this than other forms of CVA. This one is interesting in the sense that there's not going to be many humanitarian responses where the answer to this is 100% positive. But I guess it's still low enough that it sort of warrants some further inquiry whether or not it's about different modalities or whether there's enough assistance and therefore there's a requirement for advocacy, or whether this too might be tied into some sort of community engagement need. On slide 5, we found also in Nigeria that 1/4 of aid recipients don't know who to ask for support or to ask a question. This perceived lack of feedback mechanisms was also echoed by community leaders who often complained specifically about the absence of monitoring on the part of donors or aid agencies. Some respondents felt that they did ask questions, but that there was no follow-up on the questions that they've raised. And among those who do know where to direct their questions, most are still turning to NGO staff or agents for answers, while some are turning to community leaders. And that's interesting to us increasingly as there's more crossover between aid, action and social protection systems, to think about what this means for links to government as this response and others continue. Quickly to slide 6. This is a finding from the Central African Republic, just to say that not all of our findings are negative, and there are still some quite positive findings on CVA across the board. If you look at the difference on metrics of respect and participation, generally, aid recipients who receive cash and vouchers feel more positively that they are being treated with respect by aid providers and that their views are being taken into account. It's not a significant increase, but across many countries, not just the Central African Republic, this is a trend that we see a lot. So we are consistently seeing that CVA recipients do feel slightly more positive on some sort of AAP metrics, but that there's still a fair way to go. And I think it will be interesting to see how this unfolds as the COVID response continues to roll out. If we go to slide 7, one thing that we've put in place as a practical step for improvement, I think it's one thing to be constantly sharing findings, but we are often trying to find ways that these findings can be more easily acted upon, is with the inclusion of perception indicators in humanitarian response plans. So here for the Cash Working Group, we have an indicator on aid recipients who indicate that the assistance they receive is provided in a safe, accessible, responsive and participatory manner. There's a number of different composite indicators that we use to analyse that, and we find that cash recipients are more positive, except on metrics to do with communication. So again, I guess another impetus to improve on that. I'll wrap up shortly, but just a quick word on our COVID-19 response on the next slide. We've started tracking perceptions of aid recipients on the COVID-19 response in a number of countries. And with all the new interest spurred by COVID in, I guess, speeding up some of the systems change in the humanitarian space, cash obviously has a very important role to play in 2 ways. One, I suppose, by placing responsibility in the hands of affected people to decide on how aid transfers can make the most difference to their lives. And 2, as an aid modality that can easily be handled by more local actors. Of course, none of that is rocket science, but it sort of won't deliver on either promise unless we pay close attention to the way that that's working for users. At least from our initial inquiry in multiple countries now on COVID, we found that people's primary concerns are economic and not health related. But if we apply all the lessons of accountability and engagement that we've learned over many years, we're finding that the problems are still the same, in the sense that people still feel left in the dark. They don't know enough about the situation. They don't know much about the aid that they can access, which means that simply throwing CVA at the problem in itself may not be the answer. I'll quickly move on to some findings from Syria before I wrap up on the next slide. So obviously economic impact is a very great concern in Syria, not surprising. People are very concerned about loss of income, price hikes and business closures. But because people's fears, perceptions and behaviour in the time of COVID are very much linked to information that they're able to access, all of our surveys everywhere are showing that misinformation is rife. And I guess it's just a reminder to us that good CVA is not simply about handing something out, but helping to ensure that people can make the right choices with what they have. And given that the findings that we have from COVID so far on information are really all over the place, people citing everything from really wild rumours to a lack of belief in the presence of the virus at all, to perceived threats to aid provision. I guess it's just a reminder that it's more important than ever that CVA is coupled with clear information, first of all, but also with feedback channels that everyone feels safe to access. Slide 10, some similar findings about increased prices, loss of income and the ability to access shops. Also some findings related to fear, which are interesting, some grounded in reality and some not so much. A challenge that we are seeing at Ground Truth in our own work and also the work of our humanitarian partners has been that COVID has meant that accountability is not so much a humanitarian agency problem right now. So a lot of the findings that we're getting back, whereas previously we could share them with international aid actors and know that they would be able to act on them, we're now finding that those findings would actually be more relevant to governments and social protection actors, health networks, local agencies. And we're finding that a lot of those local networks are probably not as strong as they should be. This is the key to our dialogue phase. And so I suppose that would be reflected in the broader humanitarian effort in the sense that we sort of need to put more tentacles out into these community structures and social protection systems. And just a final point that in the perception mapping work that my CASH colleagues at GTS have been doing, they have found in our most recent findings that since the onset of COVID and its subsequent programmatic implications, a lot of the basic gains made in accountability really painstakingly over a number of years, where we have started to see some increases in findings on participation, for example, have already started to really fall down. So people are telling us that there's no conversation anymore, and what may often look like community engagement is really ramping up because there is so much health messaging, is actually just agencies sort of en masse throwing health-related information at people. And so I think that this needs to be our focus now. We're finding that emergency mode is never really an excuse to communicate less, especially 5 months into an emergency, but rather an impetus to communicate more with very clear information, but most of all with some sort of open feedback and communication channel that people can use. I'm going to stop there because I've probably spoken enough, but thanks so much for listening. All of our recent COVID reports you can find online, and happy to take any questions at the end.
Thank you, Meg. I really appreciate that. And I think maybe with that, we'll move straight into Catherine's presentation. Over to you, Catherine.
Thank you so much. Hello, my name is Catherine Titch. I work for World Vision International as a Global Cash and Voucher Programming Director. And I have the pleasure to talk today before around the issue of scaling up social assistance transfers and linking them with humanitarian cash transfers in COVID-19 and looking at how we can enhance the quality. And I'm just actually picking up where Meg has left us. If we can go to the next. One of the key challenges we have seen is that with this future of change and change happening consistently, we can just push through the slides, please. Thank you, Sam. Sorry, there's some moving parts. Things. We have seen that there is a big aim by multiple stakeholders to address the current pandemic and socioeconomic impact through the scale up of these protection assistance mechanisms. And as we know, there is still a big issue around everyone accessing those effectively and also being able to utilize the services that come along with them. So we know that about 1.3 billion vulnerable children have no access to social protection. And one of the major issues now, as you may have seen UNDP's report yesterday on temporary basic income, is that it's not only a financing issue, it is an issue of, even if this can be distributed across the globe, how can people accessing and being included in distribution beneficiary lists, and how can they effectively also access quality. Throughout this week, in the cash and risk session, there was some reflection around the current challenges around capacity building, localization, local actors being able to address technical power and or shift. Interestingly, in the State of the World's Cash, 62%, probably more or less our subgroup or group, thinks that humanitarian organizations are increasingly considering recipient perspectives. As we've just seen, Ground Truth is one of those actors that really drives us to do that more. But I also want to reflect some of the voices we've heard in the last couple of days that have really tried to highlight the challenge of doing more tick box exercises of humanitarian accountability, looking, for example, at more extractive than effective community feedback that then informs programming outcomes, adaptation of programming, and looks at also the aspects of inclusion through digital and analog means to ensure that really there is a representative community voice heard. We can go to the next slide, please. We know that World Vision and other actors have tried to look at both aspects of humanitarian and development assistance being much more bridged, and the Nexus discussion is not new to any of you. But what seems to be still lacking is that we create a pathway from the, let's say, underpinning humanitarian accountability mechanisms that are out there, some of them working more effectively than others, towards social accountability mechanisms. So we know very well that when governments are the ones and actually in power and in charge of transferring social assistance and broader social protection packages, it is often very unclear for many different stakeholders whom to go to or how to effectively understand the information that is maybe provided, but maybe not everywhere and not accessible to everyone because of literacy issues and other issues. Now, this becomes even more a concern when we see that there is this massive scale up now in the realm of COVID-19. So how are transfer, targeting, flows, effective reach monitored and reflected back through empowered community engagement that's consistent and also can really effectively inform programming adaptations? We see that with all this scale up, we can go to the next, please. With national governments, even when they try to optimize targeting and social assistance transfers, especially in urban informal settlements where we know spikes of COVID-19 pandemic outbreaks are likely to be continuously seen, and these community members that are in those contexts very often are the ones that are most vulnerable. There is issues around documentation. As you know, many people do not have ID cards or birth certificates that actually help to create ID cards. There is many different community demographics, from refugees to migrants, that may not have access to those documentations as well, in particular in urban contexts. So we already see that the previous complex situation is exacerbated more through the current crisis and exacerbating actually vulnerabilities. Even if government social protection transfers are meant to scale up to reach poor households, we see that, for example, in Sri Lanka, there was the goal of 47% poor households to be reached. UNDP actually indicated in an analysis with recently simulated data based on national household surveys that actually about 34% of those that were supposed to be reached would be likely excluded. So it is very critical in this time to see how the right economic, whether that's economic stimulus packages or protection scale up or whether it is basic income, can actually people at the right time in the short term, and this is very tricky. CCD, we have just actually published a paper today on our best practices around linking humanitarian cash voucher assistance to social protection in the context of COVID-19. I would encourage you to have a look at that on the CCD website. But what we clearly also want to highlight is that this is a crisis that will stay with us, and so we need to be able, in the humanitarian context and the development context, to work much closer with government actors and other actors and strengthen local actors to ensure that there is consistent humanitarian and social accountability. We can go to the next slide, please. World Vision actually uses several approaches, and one of the issues, as highlighted before, is a very complex change in power relations, and power relations are tricky. So one of the things that actually even Kalp has highlighted in the State of the World's Cash report is that the need for different stakeholders to come together and understand what the context is, what the actors can influence and should influence, and what it actually even may mean to give up in terms of power. That includes INGOs, that includes the UN, that includes maybe other actors, including private sector. But in all of that, it's also very critical to understand national government legal and policy frameworks actually look like, which ministries are involved. In the Grand Bargain Cash Workstream subgroup, we have a lot of discussions around that regarding social protection. And World Vision recently actually saw also some clear indications that this needs to be enhanced in our own organization, as well as, I think, probably across our sector. With that goes actively strengthening actually national government systems, whether it's health, education, other social benefits. And surely this goes all far beyond the cash and voucher assistance discussion, but we have seen that that cannot be seen in isolation. So I would like to briefly show on the example of World Vision's approach to social accountability, citizen voice and action, how we have used that in a, let's say, more stable context in Bangladesh, and how actually some of those examples of engaging with the government social safety net have yielded fruits, and how we actually now are trying to connect that better with our humanitarian work in cash and voucher assistance. So please forgive me, the acronyms are the same. So when I'm now talking about citizen voice and action, there is sometimes the acronym popping up that also says CVA. I will try to highlight that this is then not cash voucher assistance. Citizen voice in action works by changing power relations. It does so by using structured and transparent processes to organize collective opinion, which is harder to dismiss than individual opinions in the community. By making also criteria for judgments transparent, and by increasing the legitimacy of claims on the system. Empowering women is one very critical aspect of this approach as well, and bringing different types and levels of decision makers into the process, such that different forms of authority are available to address different issues. CVA also really clearly works through strengthening systems. So you see, it is a, I would say, constructive approach to strengthening community voices and engaging with government, not necessarily in a confrontational way, but speaking out what scorecards show, what performance of local level and national government actually look like, and then providing that feedback. The next slide, please. World Vision actually by mid-2020 has implemented citizen voice in action in over 700 programs in over 48 countries. And this is very exciting. Sorry, on the right-hand side of the slide, you see still old data, but this is quite exciting to see that really through this, and together with local partners in particular, we have been able to support the improvement of services for millions of people through local dialogue, through local engagement. You see this photo of this young lady there. This is Chantorn. She's about 26 years old, and she was a community accountability facilitator in Cambodia, in Phnom Srok district, in the Mackay. Community engagement youth focal point, and through her engagement people really learned that it's not bad to work with and through issues and complaints with those that are having positions of power and usually were very unapproachable. They saw with her that over time, those in authority started to really feel uncomfortable sometimes with the facts that they were confronted with, but also they learned that if it's a group, and usually these are community groups that come together and are being trained, would be able to voice jointly their complaints to enhance service provision, to understand better what their rights and entitlements were of social service provision, including transfer assistance from the government. So in the end, she actually has become now more than a community activist, but is now part of a wider group of people that are engaging in local government and changing local government policies and enhancing the implementation of those. Citizen Voice in Action has a whole kind of project cycle, and usually it's a longer process than just a few months of humanitarian intervention. So as you can see on the right, there is a lot of first of all, determining what the issues are, what the entitlements and policy legal provisions are in a particular given context. Then people would come together and look at building up scorecards, whether they're happy with the service or not. They would have town hall meetings to discuss what they have found and what they feel challenged with, together with government representatives, local government as well. And then they would jointly decide on an action plan, which then really also engages citizens themselves into understanding the legislative framework and also engage with the government to improve the service. So we see that this is very effective because over time there is multiple layers of engagement. It enhances citizen in their constituency. It enhances government service providers and government officials and bureaucrats' engagement with community members. And we have seen that this has been a very positive process. We can go to the next slide. One example I would like to highlight in reference to cash and voucher assistance and social safety net provisioning is in Bangladesh. So this project was a longer term project funded by multiple and actually implemented jointly between World Vision and two local policy. Looked at the government over the 3 years from 2017 to end of 2019. They had significant changes through the community mobilization that the local and World Vision staff together community settings. That was very critical, obviously, was one component of social safety net provisioning by the government of Bangladesh, which had, as you can see here, multiple components. It had vulnerable group development programs, it had group feeding, it had stipend and actually government social assistance for children, for disabled people living with challenges, physical challenges, as well as for very, very vulnerable mothers. And with those packages, what the project basically did was, first of all, establishing or enhancing union parishats. So these are union councils. Unions are usually at the smallest rural administrative and local government county or unit level in Bangladesh, and each unit has Bangladesh. And mostly these union councils and about 12 members, and then always in the past there has been obviously a bit of a gender imbalance. And with World Vision's engagement and the local partners' engagement, we have seen that over time there was a significant shift of representation in those union councils, as well as awareness and engagement around the particular entitlements. The whole project was much bigger than what I've shown you here. But what we could see at the end of the 3 years, and this is actually the project evaluation that was facilitated by the European Union, is that 69% of vulnerable people had more access to government social safety net entitlements than before. This is quite substantive. At the start of the project, there were 5% of those that were entitled, and at the end, there were 74%. Also, parallel to that, and obviously feeding to the improved access, was the massive information provisioning engagement about what the entitlements and rights were to people that, for example, were supposed to receive pensions and transfers for cash transfer. We can go to the next. So that with all of this, also the awareness around who can actually complain about what increased substantively. You see in the slide, maybe in the second row of this table, that the proportion of the respondents at the end of the project survey from the baseline increased substantively from 12% to 80%. So people understood where they could go to, how they could effectively make their voice heard. And we know that there is many anecdotes from the community where people just said, for example, one person said there was a discrepancy between those that were supposed to receive the social safety net transfer and then others did not. And the person said one person in our area was not poor, but he was selected. And when we came to know, we went to the chairman of this union council and protested. So his name was crossed out from the list. And we have many of those kind of community feedback kind of witness accounts that really have been very, very powerful. Obviously, one of the very positive effects also has been that we've seen many more women in leadership in these community groups. So not only community groups, but even civil groups forming, or those that were already established at that time, having many more women in leadership positions. This and many other very positive accounts regarding protection, for example, I cannot refer here to, but I think really showcase that there is a lot of opportunity for creating sustainability of inclusiveness and transparency among local actors. We can go to the next slide, please. So to come to a close, we clearly see that now with the scale up of social protection transfer mechanisms by governments, there is a need to bridge what humanitarian actors do and what governments do. We know this discussion. One of the things that World Vision Bangladesh text has done to scale up quickly was multipurpose cash assistance, as you can see here, to over 66,000 people within 3 months between April and June. And what was done was clearly to deduplicate and work with the local government and with other local partners to ensure that those that were already on the government's safety net scale up and registration register were not included in what World Vision Bangladesh was targeting in terms of most vulnerable households. Beyond this, very clearly, we actually are working to linking better our humanitarian accountability systems that underpin our cash and voucher assistance, as well as other interventions, as well as the ongoing citizen voice and action, social accountability, community strengthening engagement. And we would like to really enhance that further in many countries where we work. And obviously, there is a big need to do that jointly as a humanitarian and development community together with governments. So let me stop here. Thank you very much. I'm available for questions. I'll also answer in the chat box. Thank you.
And over to you, Sam.
Great, yeah, thank you very much. Sorry about that slight pause, getting a few things sorted. So we're going to open the floor for questions and answers now. I see there's a few questions that have been put into the question bar on the side. So I'm just looking if I can see these during the presentation. I see Dikra has asked about the non-blockchain based community inclusion currencies, and Adam has already responded to that in writing. I don't know if you wanted to come in, Adam, and address that verbally as well, but the written response there looks really good. Adam actually has also posted a question to Meg, Do you know if these individuals are part of the social safety protection net, or if they're only part of the humanitarian cash and voucher response? And I see Meg has actually also answered that in writing. Apologies. I see Kristen has typed in a question to Catherine, and Catherine has already typed a response. In that case, I mean, all of the questions that are asked in the sidebar have already been answered in written format. So I don't know if anybody wants to come in with a hand up. Let me check if there's any hands up. I see Sophie has a hand up. Yeah, please go ahead, Sophie.
Thanks so much, Sam. I hope you can hear me okay.
Yeah, loud and clear.
You can, okay, good. Thanks so much. Really interesting presentations to round out the week. I wish we'd started the week there. That is fantastic. And as you were talking, it just became increasingly clear, I think, to many of us that it's such an obvious place to start, that we should be benchmarking our performance and what we should be prioritizing next against how recipients feel treated and how recipients feel that cash assistance is doing. So it would have been great to start the week from there, I think. We heard some great examples of how individual agencies are taking accountability more seriously, and thanks, Catherine, for that insight into what sounds like a really interesting project. Meg, I wanted to hear from you, given that this is such an obvious starting point, that we should be looking at our performance across responses and globally in terms of how recipients feel we're doing, what progress have you seen on shared metrics, shared perception indicators, and consistent monitoring of recipient feedback across responses and globally, so that we can performance against how we're delivering rather than against indicators that we've fundamentally made up? Are there any reasons to feel optimistic there? Do you see any green shoots? Thanks.
Thanks a lot, Sophie, for the question, and also for your read on that being obvious, because I think a lot of people don't necessarily see it that way in our sector. There is some room for optimism in a number of ways. One, on the policy front, when the HPC process was updated last year, similar to some of the reforms that were made in cash, there were some quite positive improvements made to the templates for the HRP and HNO process. And one of them was the inclusion of perception indicators, which has subsequently made its way into a number of different policy discussions. And so because of that, I think the willingness of HCTs and interclusters to include response-wide perception indicators has definitely increased. That said, we're definitely not seeing it across the board, but we are seeing that year on year, more countries are interested in tracking perceptions response-wide. I think this year there's about 6 or 7 different humanitarian country teams that are including perception tracking as part of HRP and response-wide monitoring. And the way that we're tracking those perceptions to inform those indicators, we do include sort of sub indicators on cash and voucher assistance, but we do try and look at it in sort of the context of the gamut of aid responses. What we're hoping won't happen this year, but we're not necessarily sure that it won't yet, is that because of COVID, we're hoping that HCTs don't see that perception tracking becomes too hard and sort of gets put into the too hard basket, given that there's such a focus on interagency response to COVID itself. I guess our answer to that would be that obviously accountability and community engagement and perception tracking is probably more needed than ever, given the fact that a lot of the facets of COVID-19 that actually influence kind of, not to be dramatic, but life or death situations are very closely tied to things like trust and respect and information provision and feedback channels. So a lot of, practically for Ground Truth, I think we're still on track in terms of the countries that had already started to track perceptions will probably continue to do so. We're not seeing a lot of new countries, I guess, jump on board at this juncture, which last year we did see at the sort of onset of the HNO process. So yeah, I guess thanks for your question, and a reminder that we probably all need to increase our advocacy on that front to make sure that some of this accountability work has a home, I suppose, in somewhere that's sort of lodged and tracked in the HPC process.
Great, thanks a lot, Meg. I see a question here from Carla. Carla, did you want to come in and ask a question verbally?
Yeah, just a quick question to Megan. Thanks, Sam. I think it's such an important point, Megan, and thanks for highlighting this. We do see a lot of agencies, though, that do monitor their own programs and that sometimes do perception interviews and perception monitoring themselves. I wonder if, in your opinion and in your experience, it's important to do this only as a third-party monitor or as agencies themselves, and is there a difference and things like that? I wonder if that's something important from your side. Over.
Thanks a lot, Carla. A really good question and an interesting one for us, because at Ground Truth we try and promote both. So we actually do a lot of work with individual agencies to equip them to apply our methodology, if that's the one that they want to use, to tracking their own programs and sort of using those perceptions in a particular program to lead to course corrections. So I think that first and foremost, that should be done everywhere. I think if that could be done within individual agencies, we would by proxy see some improvements at the response-wide level. I think, though, looking at the response-wide level, it is quite important to have an individual or independent data collection body collecting that data, just so we can ensure that it covers a robust sampling of the overall response, which is difficult to do if one agency is doing it, I suppose, on behalf of the collective, but also that it enables sort of a second check and balance on whether the individual agency efforts are working in a particular area. So my answer to that, not to be Switzerland about it, but I would say definitely both, if possible, to be constantly being done simultaneously and also to constantly be improving. And hopefully what we're trying to see increasingly as Ground Truth is that, because we will often track perceptions at that response-wide level, and once we've done that a number of times in a certain place, if we're not seeing vast improvements, we're hoping next year and beyond to really start scaling up that work with individual agencies so that we can make sure that those who are actually best placed to act on the findings are also well placed to be able to sort of understand more about their constituent populations and see how some of these accountability metrics can be improved upon. So yeah, that's kind of where we stand on that.
Great, thanks a lot, Megan. Yeah, definitely a extremely interesting area, and probably something we can do more at the workstream level to build our connections with the Participation Revolution workstream, who are doing quite a lot of work on this. I see Adam has his hands up. Adam, did you want to come in with a response or a question?
Yeah, sure. Thanks, Sam. So just wanted to pick up from Meg and Carla's dialogue. The Danish Red Cross, when we think about CVA and using data, I guess there's different ways of assessing the impact and how humanitarian organizations release cash in the different modalities. And typically, and I'm talking from a Red Cross perspective, we look at the effects of vulnerability and coming in during a response or after a response. But a part of the movement, and specifically what my team looks at, is more about the anticipatory aspect of it and thinking about what well-being is and trying to pick up markers ahead of time. And I think this goes to that issue of like subjective data and understanding that there are already a number of existing indexes and surveys and I would say information that is taken down in that moment, but doesn't get quantified and put into databases and isn't regularly fed into systems. And so inherently what happens is that policymaking is very much a static decision sometimes. And I think this is the point that the group is making, is that is there a way to make a informed decisions in real time? And I think that this community inclusion project that we have is one example of using the data around consumption. But what we're also doing is moving into developing wellness indexes that feed off of data so that we can have this real time information, and then creating algorithms and modeling that can go ahead and do predictive analytics around hundreds and hundreds and hundreds and thousands of computations, so that when certain events happen, we can have those policies in place and try and test those out, and then allow the communities to really take more of a participatory engagement in that process, as opposed to coming down from like the north and saying, this is how we're going to prescribe the approach. And so essentially figuring out how to localize the approach as opposed to thinking about it from a macro view. And that's really difficult. And I'm, curious to the group if individuals have, thought about like how to create real-time data feeds or data lakes or glaciers that are kind of universal. But I guess to Meg's point around like incentivization, like who's going to be there to actually audit the data? Because why would a humanitarian organization or an aid agency want to show that they're not doing well, because that disincentivizes others maybe for working with them or for getting additional donor capital? Over.
Brilliant. Thank you very much, Adam. I'm going to go to Marianne quickly for your question, and then to Gerib for your question. Marianne, did you want to address your question to Catherine directly? Hello, Marianne. Okay, in that case, maybe we can email this question to Catherine and she can perhaps respond directly in writing.
See, Sam? Sorry, I see it in the chat box, right?
Yes.
On the deduplication? Okay.
Exactly, yeah.
Thanks. So definitely it was an analog and physical process doing the deduplication, because while there is social registries that are digital, not everywhere actually those digital systems are very effective and updated. So what really happened was that the team, our Bangladesh team, and the local organization partners went out and checked with the local government representatives on the actual updated printouts of those beneficiary lists, and ensured that really there was no overlap as much as possible. So I do think in the future this again leads to another discussion on joint registries, but I think with this, and also the fact that the Citizen Voice in Action is actually available as a database and also as an app, there is a lot of opportunities to make things transparent and have interagency dashboards that actually can be led and accessed by community members. And I think that would be something for another discussion and further exploration, but I hope that responds to the question. Thank you.
Great, thanks a lot, Catherine. For some really interesting questions and discussions. Gerib, did you want to come in with your question? I see you've asked for a question in the sidebar. Okay, in that case, maybe we'll just take one more from Joe Burton. Oh, sorry, Garib, yes, do you want to come in? I see you've typed in again. Over to you, Garib. Yep, please go ahead, Garib. Yes, please go ahead. We appear to be having some difficulty hearing you, unfortunately. We don't appear to be able to hear Garib. In which case, maybe I will ask Gabe to send a question in writing and we can respond by email. I think we've probably got time for just one last question. So maybe I'll go to Joe Burton from ICRC. Oh, sorry, Gabe says on mute. I'm not in control of the meeting. Dina, could you unmute Gabe?
Done.
There we go. Please go ahead, Gabe. We still can't hear you, unfortunately. I think in the interest of time, perhaps we will take the question by email and respond by email, just because we do need to wrap up fairly soon. So maybe I'll hand back to you at that point, Dina. Some really interesting discussions there. And yeah, some interesting presentations and a great discussion, I think. So I'll hand back to you now, Dina, to close out the session. Thank you.
Great. Thank you, Sam. And thank you to Adam, Meg, and Catherine for the informative and lively session. And actually, hopefully, Joe, this will answer some of your second part of the question. So before we hand over to Ken, I actually briefly wanted to highlight the work from this week. And I know that many of you know this already, but we have 7 active sub-work streams with a lot of work spurring from this week. So to underscore a few, and by no means is this comprehensive, the Tackling Political Blockages sub-work stream will be working with Workstream 5 on the Joint Needs Assessment on revisiting multipurpose cash coordination and drawing on the intersector needs and response analysis, and then working with the Grand Bargain Secretariat and hopefully the eminent person to agree on next steps and remaining challenges. I know that some of you were on the Gender and Cash sub-work stream webinar, and they will focus on ensuring that the humanitarian community has access to user-friendly cash and gender resources. And this will include applying them and generating evidence as well as sharing learning through the sub-work stream. And they will also seek actionable connections with the social protection and the local partners sub-work streams, and I believe also with the Friends of Gender group. And lastly, I know that some of you were both on the SCAN and the market presentations this week. So the cost efficiency and effectiveness sub-work stream will also continue to work on the NPC outcome indicators that will focus on developing a better understanding of human-centered and non-traditional elements, which will still play a critical role in overall value for money. The sub-work stream will also establish a platform to disseminate lessons learned and best practices on research and on efficiency and effectiveness and value for money, specifically as it relates to basic needs. And as you can see, there continues to be a lot of work around this week, and many of you are directly and or indirectly involved with this. And I guess this is a great segue to you, Ken, to deliver some of the concluding remarks to wrap up the week. So over to you, Ken.
Okay, well, good afternoon, everybody, and thanks, Tina. Just maybe quickly a sound check. If one human can tell me you can actually hear me before I carry on.
Can hear and see you perfectly. Thank you.
Brilliant. So thanks very much. And first of all, just to congratulate those of you who are presenting and asking and discussing in that last session. Really, really cool. I have certainly enjoyed listening into all of that, as have I throughout the entirety of the Grand Bargain. Some of that was by recording later on, some of it was dipping in and out of the live sessions. And so I think the first concluding remark on the behalf of the co-conveners is certainly a thank you to all of you who were joining throughout this week at various stages, for your commitment, for giving it a shot in a new and different way than we've done traditionally, and a congratulations to you for keeping such excellent quantity and quality of conversation throughout this medium. And one of the observations I think we can make is that when I think back to previous years of Grand Bargain meetings huddled in a small downstairs room in the World Food Program building here in Rome, we were able to expand the number of participants, the number of perspectives, the number of ideas that were able to bubble up through this medium. So congratulations to all of you for having experimented in this different way and really successfully. So first, thanks and congratulations. That does bring me also to a couple reflections on what we heard. I won't try and sum up. There will be some more follow-up coming on the summary of the various sessions, and Dina has just helped us figure out where some of that will go in terms of work stream moving forward. But maybe a couple of reflections that slightly stepping back a little bit from the individual content. One of the things that was really compelling to hear, thinking back to some of the early Grand Bargain, the actual meeting itself, the Grand Bargain meeting itself, and the follow-on of the cash work streams, is I recall an enormous conversation about quantity, more cash, more cash, more cash. We don't want to ease off on that. We do want to congratulate so many of the various stakeholders who, in the ODI report, it's documented that the quantity surge is happening, both from the operators and from the donors. This is a good thing. But even more exciting to me is the quality conversation. The fact that we're moving beyond purely the delivery into the qualitative benefits, the qualitative results, the impact of the quantity, that theme, that thread continues to bubble up more and more in the conversations. And for me, two particularly heartening parts of the quality questions. One of them is we were always talking about sort of economic benefits for households. We were always talking about the impact on markets, but I think that we're hearing it's been a continuous thread, but an amplified conversation, particularly about the gender dimensions, women empowerment dimensions of cash, and we're hearing more and more about the protection elements as well. So to me, these are qualitative enhancements to the conversation, which we've seen in the progression over time that I heard over the course of this week, which were really encouraging to hear. It shows a work stream which is dynamic, which is still focused truly on the value that we add to the people who we're trying to serve. So that was really, really heartening. Another thing that was really heartening, not only did one of the early conversations we had around the Grand Bargain in general was that there were too many missing voices. The missing voices from the localization agenda was discussed somewhat in Istanbul. It's been part of the Grand Bargain stream, but we talked very much about the missing voices of other actors who had not been formally signatory to the Grand Bargain. We talked about particularly the role of host governments, governments of the countries where the humanitarian action is necessitated, not having necessarily been part of the signatory or the Grand Bargain conversation, and very much the beneficiaries themselves having not had a voice in the Grand Bargain conversation. And I feel like, and I'll reflect on this in a minute again, but I feel like this week we're starting to see a gradual uptick in this inclusion of more of the missing voices in the CBT or the cash work stream, which is really, really encouraging and nice to hear as a qualitative enhancement of the Grand Bargain work stream conversation. So this was really great to hear. And then I'm thoughtful about a couple of questions, thoughts around what was the original intuition, the urge, the momentum behind the Grand Bargain in its fullness, in its inception in the first place. So those of you who have the gray hair that I have and can remember only a few years ago, there was a moment where we had seen this huge growth in assessed needs, humanitarian needs of people around the world. And we saw a big gap in how large in dollar terms and human terms the need was with the resources available. And the bargain was this conversation between those who were hoping to try and help address the identified needs and those who we were asking to fund or finance that work. And the gap was enormous. And so there is this palpable sense that something has got to give, something is in this system has got to change. And I want to just sort of as a reflection moving forward over the course of the next year, think about that. Have we passed that moment, or is there still a sort of something has got to give kind of intuition? And my sense, listening in on the conversations this week, is that the cash workstream was very much part of the disruptive element, the change in the humanitarian system. Something has got to give, and the cash element was a big part of that evolution in the humanitarian system. We even use the word revolution, cash revolution in the humanitarian system. My sense, listening, is there's actually two additional elements that we really want to take seriously in that big picture of what is it that's really changing. And I think a number of you referred to it over the course of this week. One of the big changes which we see, which we welcome, which we need to try and understand better, is the shift in power dynamic. We've talked about that in lots of different ways. And to me, the tremendously exciting part of the shift in the power dynamic is not from, donor to recipient, or from, one kind of sector to another. The big change, the something that's got to give, that feels like it's starting to bubble up, is truly the changing of the power dynamic that puts the beneficiaries, the people who are in need, themselves increasingly empowered to be steering, directing, guiding, improving, enhancing, channeling the way that the humanitarian system better supports and serves them. So I realize that's a glass half full interpretation. That's an optimistic interpretation. But when I listen to the work that's going on in the digital realm, all these new ways that beneficiaries can use technology to guide us, to steer how we behave to them, to guide how and whether we listen to them in the first place. There's always that boots on the ground, face-to-face, sitting and listening and chatting conversation. But there's also a technological aggregator of those voices of that are steering the way we work. So I do see this very disruptive trend, not in the cash, but in the way that in order to do the cash, we have of necessity started to learn how to listen to and let the beneficiaries, let those in need of assistance guide us. That is a new, long overdue, highly powerful thing that I think is spilling out of this, particularly out of the cash workstream, as well as the localization agenda and so on within the Grand Bargain. So I hope, Joe, in answer to your questions, one of the things that we can spend some time coming up over the course of next year is reflect a little bit on that element of and feed that back into the eminent people and the Grand Bargain mothership, as opposed to the cash workstream itself, as something that's really bubbling up in the cash workstream that we need to leverage and amplify and truly wrap our minds around, because that brings a whole new set of normative issues, policy issues, technical issues, as well as relationship issues and power issues and financing issues. So this is something that is really coming clear in the Grand Bargain cash workstream that I find really touches on that initial intuition of something in the system has got to give. The other thing that I'll touch on, and then I promise I'll pipe down, is the COVID has taught us, certainly this is now me at WFP, but I see it reflected in you, so many of the comments that you are all making and the presentations that you're making, and certainly it's reflected statistically and at the aggregate level. COVID is showing us the role of the humanitarian actor in this kind of large, global scale, acute need situation is a different role than it used to be. And it's maybe not the one that we're accustomed to, but the governments are in the driver's seat. And when we look at cash in particular, we see humanitarian agencies, as always, doing a very good job with cash transfer programs, CVA programs, but we see that dwarfed by the government programs. The numbers of governments, the scale of governments, the financing, which is bilateral through IFIs into government hands, that is dwarfing the world of humanitarian action, CVAs. And taking that seriously, of the relationship that we have with government to accompany government to figure out where we bring added value to a system that has a much greater governmental role enabled by government CVA programs in various forms, whether they're emergency programs, social protection programs, and so on. That to me is another big thing which is bubbling up in the conversations we had this week, that's bubbling up in the external world around us, that we need to take really, really seriously as a sort of community of CVA practitioners within the humanitarian sector, looking at the world around us. This is a really big deal, and we need to take that seriously. So that's the other thing that I heard bubbling up quite often through this weekend, even just in this last session. And how those two meet is a really interesting conversation. This idea of the beneficiary empowered, the recipients of humanitarian assistance being more and more empowered, and at the same time, government having a greater role in how the work is implemented and funded. That leaves the humanitarians in this very interesting brokerage role between those who need to be equitably included and those who are implementing large-scale activity. That does change the role of humanitarians, but it's a really critically important role. So to me, that's something else that the cash workstream is really highlighting and teaching us, that I will look forward to trying to figure out how we work with all of you, how we learn from all of you to figure out how to feed that in and take that kind of work forward. So maybe that's more than you wanted to hear from me. Maybe it's an insufficiently resume summative and a little bit too speculative. But that to me is the sort of value, part of the value of these grand bargain sessions. It gets thought flowing, it gets stimulation, it gets exchange and cross-fertilization of ideas, and gives us all a chance to step back from the day-to-day work of trying to support program in country X, which is delivering asset Y, and really think about where this whole system is going. And that to me just sort of reinforces the value of this meeting, of this group, this community, and of what we can feed into the broader humanitarian system when we raise these issues and what's emerging and learning. So for that, I'll just say thank you. Again, a huge congratulations for participating and for bringing so much onto the table, even this challenging, logistically challenging year, as well as, far more importantly, the challenge that this world is living through from the point of view of true and real humanitarian need, and all the incredible work that all of the agencies participating in the Grand Bargain are doing to address that work. So a congratulations and a thank you, and back to you, Dina.
Great, thank you very much, Ken. And I think maybe with that, there's been a lot of comments in the chat box. So just to acknowledge the fact that we will be continuing a little bit later, probably after August, when everyone's back from various holidays. But just to say that there are a lot of calls to reflect on the messages and the advocacy, and a lot of asks that have come out of this week. So I think we will have our work cut out for us, as I said, and hope to be in touch with you. And I know that Sam has responded to some of you in the chat box. But maybe with that, I'll say this is not a goodbye, but see you later. And thank you again. Bye-bye.